So, sleep paralysis happens when your brain is awake, but your body is stuck in the REM stage of sleep. Now, naturally, the REM stage of sleep is a stage where the muscles are paralyzed, right? Nothing is moving. And so you can imagine the fact that your brain wakes up, but you're in that REM stage where the body can't move. And so it feels like you're awake, you're conscious, but it's like you're frozen. You can't get out of that. You can't get out of your bed, and this could happen for a few minutes. Now, some people may even have hallucinations while they're in this state of sleep paralysis. And this is because, the body doesn't know what to make, or the brain and the body doesn't know how to match this to, scenarios. It's like, how can I explain that your brain is awake, but the body is in REM stage? And so there's confusion about what's really happening. There's some kind of misperception. Am I awake? Am I asleep? Am I in REM stage? And so people could have hallucinations during those events. Now, sometimes sleep paralysis can occur with a sleep disorder called narcolepsy, but we're not talking about that today. We're talking about isolated sleep paralysis, where the only thing that is going on is sleep paralysis. There is no concern for narcolepsy with symptoms such as excessive daytime sleepiness and so many other things. I'm going to talk about narcolepsy in another video. Now, I want to share a few things that could bring about sleep paralysis. There are some triggers, some things that could make this happen more frequently. One is any disruption of your circadian rhythm. And that includes when your sleep schedule is irregular. You don't have a consistent bedtime. You don't have a consistent wake up time. Number two, when you're sleep deprived. And a lot of people are sleep deprived. And what is sleep deprivation for adults? Any adult sleeping less than 7 hours is sleep deprived. Now, the normal range of sleep duration, as recommended by the American Academy of Sleep Medicine, is 7 to 9 hours. So, anything less than 7 hours, you're sleep deprived. So, sleep deprivation is a cause. Inconsistent sleep schedule, stress, anxiety can bring about more events of sleep paralysis. And the last reason is the sleeping position. Now, when you sleep on your back, you're more likely to have sleep paralysis episodes, and they are more likely to last longer. Now, let's talk about what you can do if sleep paralysis happen. And before then, one thing I want to say is that sleep paralysis is harmless, especially if it's isolated. It is benign, there are no issues with it, but it's very frightening, right? Because you're waking up, you're awake, and you want to get out of bed, but you just can't. They typically happen for about 2 minutes, but could go on for longer, especially if you stress about it. If you're like panicky, then it could even last longer. Now, what can you do to prevent these from happening? One, make sure you're having a consistent sleep schedule. Bedtime and wake up time, more especially your wake up time. Sometimes it's difficult to control your bedtime, but once you're able to regulate your wake up time, then your body is more able to regulate your bedtime. I know that kind of seems backward, but yes, that's really how it works. Now, another thing is making sure that you get as much sleep as possible. 7 hours and above is what is recommended. Essentially, making sure you're not sleep deprived. Another reason is making sure that there are no disruptions to your circadian rhythm, right? If you're traveling, you're going to a different time zone, making sure you're keeping the same sleep schedule as what you had in the place that you're flying from and to the new place, right? So making sure that you have same circadian rhythm and no disruptions in that rhythm. Last but not the least is to watch out for any stressors and things that can bring about this. And really, for my patients who are dealing with sleep paralysis, I tell them to keep a sleep diary. Right when this happens, look back at the day before. What changed? What was different? Did you use alcohol, tobacco, whatever? Was your sleep schedule different? Did you go to bed late? Did you sleep in another place? Some people, when they travel, they're not sleeping in their bedroom. They experience this episode. So keeping a sleep diary is also really helpful.